Na, kung meron kayong ibang kasama sa bahay nyo, lalo na extra precautions pag meron kayong kasamang matatanda sa bahay. Extra precautions po ito. Isolate yourself as much as possible from the others. Mga kubyertos, mga baso, mga gamit nyo sa pagkain. Maintain it na sa sarili mo na yon. Hindi nyo ihahalo sa ibang tao. Paggamit ng banyo, usually ang maganda dyan, paunahin nyo muna yung ibang kasama nyo sa bahay, kayo ang mahuhuli kung kayo yung naka-isolation. And the most important thing you can do once you have that is to wash your hands. Wash your hands frequently. Wash your hands, even the things you touch, you want to disinfect them as much as you can. Okay? So, with that, let's go on to the next question. Neil is asking, if you have tonsillitis and have fever, what do you do? Okay, tonsillitis, fever, most likely if you have tonsillitis, you are being and have a fever, most likely you have a bacterial etiology that is causing the tonsillitis. Ano ibig sabihin, bacterial po ito. So, pag nandun, pwede kayong pumunta sa doktor. No, again, no need sa ER. Pwede kayong pumunta sa doktor, patingin kung tonsillitis nga po ito, sisilipin ng doktor. Anong grade o anong level ng infection ng tonsillitis meron kayo, at pwede kayong bigyan ng antibiotics. Pwede kayong bigyan ng antibiotics para dito. But then again, do not self-medicate. See a doctor first if you have tonsillitis, especially if you do have fever. So for the fever, pwede naman kayong bigyan ng antipyretic or gamot pampababa ng fever ninyo tulad ng paracetamol. Okay, next question. Eksakto. Paracetamol ba or ibuprofen ang gamot sa symptoms ng COVID-19? So paracetamol and ibuprofen are medications that are used to control the symptoms of a person who may or may not have COVID-19. Ang paracetamol is usually a pain reliever as well as an antipyretic, or ito ay gamot para bumaba ang lagnat. Ibuprofen also is in a class of medications called NSAIDs or non-steroid anti-inflammatories. Ang ginagawa po nito ay pampalunas ng sakit. Kasi ano po natin, di ba, pag nagkakaroon ka tayo ng lagnat or flu, masakit ang kasukasuan, pwedeng bigyan ng ibuprofen. Ngayon, ang latest tanong, I think this is why nagkaroon ng question na ganito. There was some information that ibuprofen will make COVID-19 worse or mas makakalala pa ang COVID-19 kapag uminom kayo ng ibuprofen dahil mas mapapababa daw ang immune system nito. This came from France. Ang sagot doon is there is still not enough evidence. There is still not enough evidence to support that ibuprofen lowers your immune system significantly enough that it will aggravate the flu or COVID-19. So as of now, it is still okay. It is still okay to take any of these medications to lower your fever or to control the pain. Okay, next question. How long does the virus live on surfaces? Excuse me. How long does the virus live on surfaces? So there have been recent studies, the very recent ones released by the WHO, where the virus can live up to certain degrees sa different surfaces. Meron sila lumabas sa study na sa copper surfaces, it can live up to 4 hours. Sa mga plastic or stainless steel, it can live up to 2 to 3 days. And sa mga cardboard materials or sa mga packages, sa mga mail cardboard materials, it can live up to 24 hours. So these things are sort of guidelines to be aware of certain conditions. Ang rason kung bakit natin gustong malaman kung gaano katagal ba ito nabubuo sa isang bagay or hindi, safe po ba na tumanggap ng package mula sa anumang shipper or mail, or pwede ko bang hawakan ito ng ano. So these are the guidelines. Again, 4 hours on copper surfaces, 24 hours on cardboard, and 2 to 3 days on plastic and stainless steel. So the important thing here to note is wash your hands frequently, disinfect the things before you touch them as much as possible. Okay? So, it is natin baguhin. Kung dati hindi tayo sanay sa paghuhugas ng katawan, sa pag-disinfect, gawin na natin ngayon. Okay, we have a question from Angelo Solera who is asking, high risk ba kapag hyperthyroid ka? The answer to that, if you are hyperthyroid and exhibiting symptoms of your hyperthyroidism, then yes, definitely you are, I'm sorry, let me get this question correct. High risk ka ba of, I assume it's contracting COVID-19. Yes, if you have symptoms of hyperthyroidism, then your immune system is already not at its optimum at this point. So ideally, you want to control your hyperthyroidism first and then assess your treatment for any symptoms that you may have. Okay. Ayens is asking, she is experiencing back pain, mild headache, diarrhea times, a dry cough, and shortness of breath. Paano po kaya maganda ng gawin? So, ayan, the symptoms na sinabi nyo already constitutes you to seeing a doctor. The one that is most warranted here is your shortness of breath. So, because you have shortness of breath, you want to make sure kung ano ang nagkukos ng shortness of breath na yun kasi ayaw natin ipasabahala ang shortness of breath. So, definitely go see your doctor as soon as possible. As soon as possible. Next question we have is from Jimmy, who is asking, how long until you feel better and recover? Okay, so for this question, gaano katagal ba bago gumanda ang pakiramdam ng isang tao? It will vary depending on the individual, but on an average, a person will feel better within 10 to 14 days. So this is still the normal course of not just the COVID-19 but for any virus. So other people you might see might still be sick past these 14 days. These are the ones where the immune system is already having a hard time trying to combat this. That's why throat, headache, fever, on average, gagaling na kayo within 14 days or 2 weeks. Another question from Jimmy. Yan pala yung question ni Jimmy. Okay, we have a next question here. Can pets carry the virus? Okay, good question. For COVID-19, there is still no evidence that pets will carry COVID-19. A lot of people say no. I've heard this question actually a lot. But the coronavirus, as I was saying, the question is, can pets carry the virus? Ang virus ba ng COVID-19 ay pwedeng mapunta sa mga hayop? Wala pang ebidensya, wala pang concrete evidence na nagsasabi ang COVID-19, ang virus na nag-aapekto sa tao ay pwedeng mapunta sa mga hayop or pwedeng dalhin ng mga hayop. Coronaviruses though in general, there are several forms of coronavirus. Merong coronavirus na nakakapag-apekto sa mga pets, pero so far hindi yung COVID-19. Okay, that was a lot of questions. Thank you for all those questions that you have sent in. Unfortunately, that is all the time we have for today, but we will still keep on gathering your questions, so keep sending them in. We will be answering those as much as we can. I'll be back again tomorrow with these questions, but in the meantime, please stay safe, stay healthy, wash your hands, practice social distancing. Please follow this quarantine of ours. It does help. Hindi lang to pasadya or pa anything, this will really work. So follow those advice. Keep your questions coming. If you have anything else, I will answer them as much as I can tomorrow. Okay? Again, see you. Thank you for watching FB.